Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Good morning. I wanted to thank you all first for the Concussion Fix program. Really appreciate it and all of your efforts. I have two main questions today. I have had two concussions in a year and a half. And one of the most impacted things for me has been my eyesight, my visual field. Um, and I think I didn't realize how far off it was. I moved to Europe for half a year last year, and my eyes just couldn't track all the motion of being in like public transportation. And I started to get way more head pain. I already had prisms in my glasses pre-concussion. And so one of the things I got excited about in the Concussion Fix program is when Dr. Marshall was saying, if someone's trying to put you in a really long vision therapy plan, that may not be always the right thing, because obviously we're working with neck dysfunction and, the vestibular field, et cetera. So I guess my question is this. I think that I already had some pretty significant vision issues even before I got concussed, and then they were majorly exacerbated in both incidents. And so now I've just come back to vision therapy in the States, and it seems like it's going to be a long program, but I do also feel like, because I'm wildly tired, and then I have a lot of head pain that seems to be related to the vision. So how do I know what's what with the treatment plan, how long to keep going, when to look at other things? One last thing I want to say is I've been to like a concussion recovery clinic where we've done full-blown diagnostics, and the way that you described, putting together in the right way, shape, and form, kind of the order of things. So I think this is where I don't know where to go next.
Yeah, so you had vision issues pre-concussion. Typically, concussion will exacerbate your weak spots, right? So if you're really inflamed and you have a poor diet and your gut health isn't great, concussion's going to exacerbate that because that's your weak spot. If you have pre-existing anxiety and depression is going to be your weak spot, and that's going to be the area that's going to exacerbate all your symptoms. So this could be that you had pre-existing vision dysfunction, and concussion's just going to exacerbate that, and it's going to key on that. The other thing to consider, because vision is so tightly related to neck function, is that you also could have had pre-existing neck dysfunction that was contributing to your vision, and now concussion is going to cause more neck dysfunction, and that's going to contribute further to your symptoms. So it could be a combination of both. You could have neck issues that are contributing to the vision, and you could also have some vision problems. Now, what I always recommend that is, if you're going to do vision therapy, make sure you're also doing neck simultaneously, because the two are going to be additive. If you're on a budget and you're saying I can only pick one of these, then I would start with neck, because if you don't have good neck function doing vision therapy, you're going to hit roadblocks where the vision therapy is not working, and it's not because the vision therapy is not important, it's just because your neck can't function. Now, the way you describe it, that when you do the vision therapy, your headaches get worse, well, to me, that signals neck, because with eye movement, your neck muscles are engaging. Every time you move your eyes, your neck muscles are engaging in preparation to turn your head in the same direction that your eyes move. So when I turn my eyes to the right, every muscle that's designed to turn my head right engages. Now, if I'm doing these eye exercises, those muscles are constantly engaging. If they're dysfunctional, that starts to cause referred pain up into my head. So you feel it as a headache, head pressure, head pain. It's actually coming mostly from the neck. And you're going to say, well, it's my vision, because every time I do vision, then it's my headaches. But it's actually this kind of full circle where the eyes move, the neck engages, the neck is what drives the headaches.
Yeah, I get that. So I see a chiropractor like once a week, and
Is he just doing adjustments on you though?
Mainly adjustments, yeah.
Not the right thing.
Okay.
Adjustments won't do anything for this. It's soft tissue work. And a lot of
Okay.
times people ignore things like deep neck flexors. They don't treat the front of the neck. They'll push on the suboccipitals and that'll be it. That's not what you're looking for. I did a two-part series. It's in the resources. It's manual therapy part 1, manual therapy part 2. I break down all of these kind of relationships and show you like what you're looking for, and then I have example videos of me like treating somebody to see like, oh, this is the type of treatment I should be getting. Just because you're going to a chiro doesn't mean that they're treating the right thing or the right way, right? So you have to find somebody who's actually going to treat those things, and I tell you exactly kind of what things to look for, and then
Okay.
I would try to find that in addition to vision therapy, um, because otherwise vision therapy is probably just going to flare your symptoms up if you have a neck issue. And it's just going to cause increased head pain and it's not going to be effective and you're going to just spin in circles and spend a whole bunch of money and get nowhere. So you need to have that neck. Like, I mean, one of the examples I always use is our vision therapist. When I first met her, her treatment plan for PCS was a year long. And I was like, that's crazy. And then so I started talking to her about the connection between eyes and neck. And then she started referring all patients to me before she would see them. Her treatment plan now for PCS is less than 3 months long. And now it's kind of standard to say, go get your neck worked, right? So a lot of vision therapists don't know that even, right? Like I gave a talk in Dallas a few years ago at like a vision therapy conference about the influence of the neck on eye function. And I showed them all this research and it was just like gaping mouths looking at me like, what? Like they had no idea. So
Yeah.
a lot of people don't know this. And so I would just try to incorporate both.
I think that's great. And the concussion recovery clinic I went to actually has me doing neck exercises and the
Exercises won't
NMT.
work. It's
Okay.
not exercises for this. It's unfortunately
Okay.
it's manual therapy. It's really good manual therapy. Exercises won't really do
Got it.
anything because if you have muscles that are stuck to other muscles and they're tense on one side, ultimately it's like you can do these types of exercises, but you're going to have an altered movement pattern, right? Like if I have a shoulder injury and I try to lift my shoulder, I'm going to do all these weird contorting things to be able to do the movement. Your body's very good at changing the movement pattern to get around dysfunction. And so you're doing the exercises, but all I'm doing is reinforcing a bad movement pattern. Whereas if I got in there and actually worked on some of those tissues and had good joints, but now I can actually do the motion properly. So the way to do it is manual therapy, clear up the dysfunctions, then you can start doing the exercises and strengthen to keep it where it's at. But if you're strengthening before those dysfunctions are cleared out, all you're doing is reinforcing those dysfunctions.
Great. And is ART considered manual therapy or is that
Yes.
also different?
No,
Okay.
ART is what I do. That's the one I recommend. So in that thing, I generally recommend finding somebody who is ART certified. Um, Bonus if they're a chiro because then they can also adjust the joints. And then also if you go to their website, right, do a little bit of research on them. And if one of the primary things they treat is like headache disorders, they're probably pretty good at treating necks because that's why they're treating headaches, right? They're treating headaches because they're neck related headaches.
Okay, awesome. My second question is just about hyperbaric oxygen. I know that, in the concussion fix, the other clinic that I went to, it's actually not recommended because it seems like it's more of I've heard that it is more of like a placebo effect.
Hmm.
And recently I've had 5 different people from my primary care to all kinds of people recommend it. And I'm just curious if you could speak further to that. I've also, I just want to say one last thing. I've also had COVID several times. So brain fog, cognitive, that's a bit of a thing for me. And at the clinic I went to, I used something called the carbohaler, and that was actually really helpful. That felt helpful. But hyperbaric, I literally, people say to me all the time, "Oh, I had a friend who healed from hyperbaric. I had a friend who's done that." So I'm open to why it's not not sort of in the mix.
So, I mean, this is a contentious issue because, like, I talk about it in our training course, and I have people that are in our training course who are medical professionals and whatever that'll be like, I think you're wrong on hyperbaric, and here's why. Now, I come at it just from a research perspective, right? I have no experience in hyperbaric. I'm not a hyperbaric, expert or anything like that, but I read the literature on it. And all of the studies that are poorly done, meaning that there's no control group, right? If I take a group of 100 PCS patients and I put them all into the hyperbaric chamber, they will improve. And the results of that study look great, right? Yes, everyone had an improvement in their symptoms and they started feeling good from a cognitive perspective, whatever. But that's not really a good way of doing it. You have to have some sort of control where you need a placebo, right? Like if we were going to test a drug, we wouldn't be able to just give everyone that drug because we know how powerful placebo is, because everyone getting that drug is going to improve. And then we're like, hey, the drug is great. No, no, no. What we have to do is give half the people the drug and half the people a non-effective, let's call it just a sugar pill. But they think everyone thinks they're in the treatment group, and then you see what happens. And if both groups get better to the same degree, then it's placebo, right? Because everyone just thinks they're getting good stuff, and then that just improves people's, symptoms, because placebo is a powerful thing. What you need to do is have a significant enough difference between the placebo and the actual therapeutic drug to say, oh, the drug has this much of an effect over placebo, meaning that the drug actually does what we need it to do. With hyperbaric, the studies that have been done that are poor quality, meaning no control, no placebo, they show benefit. But then when you have a placebo where it's like you put people in the hyperbaric, but you just give them what's called surface air, meaning there's no pressurization and they're just getting normal oxygen levels at, 21% atmospheric, which everyone else is breathing. Put them in the tube, same treatment protocol. Guess what? Both groups get better to the same degree. So the recommendation now from a number of consensus statements on this is that there is strong evidence to suggest that hyperbaric does not work for PCS. Right? So, but the people that are proponents of it, they will quote these other studies that, are poorly done trials that show that hyperbaric is effective. But when you look at the higher quality studies with a placebo and a control, they get better, yes, but to the same degree, meaning that there isn't that gap between placebo and hyperbaric. Now, one study, right? So let's say there's 5 or 6 of these more high quality studies. One study recently in the past 2 years has come out and actually had a really good control, and hyperbaric did do better than the control. So that's only
Uh,
one study. So I'm not saying that this is completely out,
yes.
but right now we have 5 studies that are high quality that show no effect, and we have one study that's high quality that shows a positive effect. So
Okay.
maybe as more research emerges, I'll change my position on this. But right now, I just think that it's an expensive protocol, and so far the evidence doesn't really support it being any much more than a placebo, right? If people like, and the reason why clinicians may be recommending this is because they might had a patient that had PCS that went and did this and they got better. So they're using that as their, oh, try hyperbaric because this patient got better. But how do we know that patient wasn't under the same placebo that other people are, and they're actually just going in there with the positive idea that this will work, and then they do the treatment, and it's mostly the mental health and the anxiety that goes away that actually makes them better. Do you know what I mean?
Right. It makes total sense. Yeah.
Yeah.
No, thank
So I mean,
you.
you're welcome to try it. It's going to cost you money, and maybe there's a positive benefit there, probably from a variety of different things. Like there's evidence for hyperbaric for a number of conditions. It wouldn't
Hmm.
surprise me that there's something there for concussion, but so far the
Hmm.
evidence doesn't really support it, and it
I
just
think there
depends on
is something,
where you want to put your money, where you want to put your time, where you want to put your effort.
there's mechanistically something that I think is to it, but I think that, as Dr. Cam pointed out, up to now the research has been kind of heavily biased. But just so you know, it's 40 treatments and it's like, 150, $200 a pop
Yeah, it's
for a
expensive.
treatment.
Hmm.
Every
So
day, every day for an hour for 40 days.
right, and so there are some potential side effects. If that's some people with eye issues, if it's some people with like ear pressure, not to mention the time. So all that has to me that factors into the algorithm here in terms of the benefits of the treatment or not. Uh, that being said, if you have the money and you want to do it and you've exhausted everything else, I think there could be something to it mechanistically, and we need more high quality trials to prove that.
Yeah, and like my position on it. Sorry to cut you off there, but like my position on it is, we have all sorts of really good evidence that these things work. And then people want to go for this like hyperbaric, because it's almost like, well, this seems easy. I just lay there in a tube for an hour and then it cures everything. That's not really how it works. It's like the way to fix PCS is to actually put in the work and fix those systems. It takes work, it takes time. It's frustrating, but we know that it works. We have really good evidence for it. Over here, we have really good evidence that it doesn't work. and we have a few low quality studies that show that it does work. So if you're going to spend your time and effort, I would prefer to push people over here to things that work rather than have you waste a bunch of time and money doing something that maybe at best you get a placebo out of. And the
Yeah,
research has changed.
which is why I haven't even tried it, because of everything that you're saying, both of you, Dr. Paul and Dr. Marshall. It's exactly why I haven't tried it, because it's expensive. I do have ear issues, etc. But I can't tell you the amount of people who keep coming, back to me saying it, and I'm like,
I hear it every day. Like, this is one of the most common questions that we get is about hyperbaric. And so I don't know, they must have done some great marketing
yeah, somehow,
because
yeah.
you have something that has a lot of evidence against it for this particular condition. And yet it's still like one of these things that all these people are touting. So, I mean, maybe there's something there that just we can't study well. I don't know.
I think there's also a novelty effect where sometimes the treatment that is the most kind of um, expensive, also kind of invasive, there seems to be a perception of that it's got to be better. There also is this
Right.
kind of cachet around, like, athletes using it to recover, and oxygen's really good for you, so this means pressurized oxygen should be even better. There's like a lot of different factors. There are some clinics that just like they've created a whole business model about just doing this, not necessarily doing good concussion and PCS recovery care, and this ends up being one of the biggest factors. To me, it's like, do the CFix, see the providers, and if anything's left, then and you have the cash, then start.
Then go experimental.
Yeah, go look at that.
And is there a last question is there a way then to flag? Because I know I've seen on your website there are certain providers that are trained by you to,
Yep.
diagnostics, et cetera, but none of them. I'm in Austin, Texas currently, speaking of Texas, and there's just not many or any people that I've seen that are actually trained by you all. Do you recommend flying up to see someone for a week or so?
No, because it doesn't work like that, unfortunately. So there's clinics all
Okay.
over the US, right, that'll charge you, again, getting back to the cachet of like, well, if it's expensive, it must be good. You have these clinics throughout the US, I won't name any names, but they'll charge you, 10 to 15 grand for a week intensive, right? And it just doesn't work. Concussion doesn't work like that. You're not going to recover in a week, right? And so the reason why I don't recommend people like flying to our clinics to see somebody is because the treatment protocol they're going to follow is going to take weeks and weeks and weeks. And unless you're planning on flying there every week to see them, right? It's going to be a complete waste to go for 1 week. Like if people want to come see me, for example, like I've had people fly over from Germany that want to see me. I'll tell them like, you better plan on being here for 3 to 6 months, right? And if you're willing to do that, then maybe we can talk, because seeing me once, twice isn't going to do anything for you, because it's going to, we have to work on some of these things. It's going to take some time.
I mean, it could be a start though. Like sometimes people go somewhere and they get like really good assessment, and so in these cases where you don't have anyone locally, I definitely hear you when you're saying that. You might go and look for somebody that is maybe within driving distance. So you have to maybe drive 2 or 3 hours, or maybe go to the state beside you. And then you go back to your local provider with kind of an idea or plan, being like, hey, you have to do this. And I know that onus is a bit more on you, but I sometimes do this with providers or patients that don't have access to providers locally. We'll bring them in, just assess them, but don't expect you going somewhere is going to cure the concussion. I mean, there's clinics.
Oh, of course, yeah.
That like this is their jam. That's they do. So there needs to be that like continual treatment and follow up, and ideally you have somebody that you see regularly.
Yeah, I was talking more about the diagnostic, Dr. Paul. So exactly what you're saying. It's just getting more for the right diagnosis and then going back locally.
There's something to that, but I think there's a lot of bells and whistles in these big fancy clinics that might do it. And again, don't want to disparage that. Sometimes people find some benefits, but what often happens is that the basics, like the stuff we talk about in CFix, just falls through the cracks, and patients don't actually get to those things because they're so focused on the gyrometer that they're in, or they're so focused on like the HPOT treatment that they did when they went to this retreat. It's if it's done the right way, it could be a good way of figuring out, all right, what's going on. But ultimately, you're gonna have to go back home and have somebody treat that for you and guide that process, right?
Right. Thank you all so much.
You're
I
welcome.
think a lot of people are really looking for this sense of like security in their providers, right? So if you don't have somebody close by then it's sort of this sense of, oh, I feel kind of like on my own with it, right? And I know, number one in my clinical practice is people with chronic health issues and PCs, we need validation, we need to feel safe, right? So if we don't have that, sometimes that's what an assessment does for people, is just to say, I have this piece of paper that tells me what my plan is. I can feel safe with that. I can feel good about where to go. Then you can find your providers to sort of support you with that. But I think, one of the things we really aspire to do here is provide that community of support and ongoing, we're not going anywhere, we're here for you. That even just knowing that you have a community to lean on can, within a framework of treatment, can be really supportive.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.